Welcome to this educational infomercial on Peyronie's disease and Priapism. My name is Ariana Villasar, and we will be discussing the causes, changes, treatment, and severity of these sexual dysfunctions. Let's begin. What is Peyronie's disease? Peyronie's disease is the curved and painful erection of the penis, which is caused by plaque formed beneath the skin on the tissue of the penis. The plaque will feel hard and flat, and it can appear on the top, bottom, or on either side of the penis. It could also be a band of hard tissue around the shaft of the penis. Shortening of the penis is possible due to the plaque preventing the tissue around the penis from expanding during erection. Peyronie's disease can go away on its own, and it is estimated for 6 to 15 months for mild symptoms and 1 to 2 years for pain to improve. Peyronie's disease is typically caused by injury to the penis, but may appear out of nowhere as well. That's because Peyronie's disease is hereditary and can also come with age. However, if you know someone or have a young male relative with a curved penis, do not panic. A man's penis comes in all curves and angles, and as long as there isn't any pain associated with erection, everything is fine. Stay alert anyway because there is no known or certain cure or prevention. What is Priapism? Priapism is the prolonged and usually painful erection of the penis caused by the inability of blood flow out of the penis. The biggest culprits are constricted veins and blood clots. The two types of priapism are ischemic, which is the most common and most dangerous type, and non-ischemic. Ischemic priapism creates black blood in the penis because veins do not relax after an orgasm, and the oxygenated blood is trapped within the penis. Non-ischemic priapism is a milder form of ischemic priapism because blood eventually flows out of the penis. The duration of both is upwards of 4 hours at any given time. Seeking medical help as soon as possible is advised. Unlike Peyronie's disease factors that are either unfortunate or random, priapism is derived from many factors. It is typically caused by sickle cell anemia, a disease that prevents deformed red blood cells from transporting oxygen within the body, and leukemia, which is cancer of the blood. Priapism is also caused by medication like antidepressants, alpha blockers, and psychotic medication, but also drugs and alcohol. Injury to the penis was also listed as one of the causes, but that's more a cause for Peyronie's disease. Now that we've defined the causes and changes, let's talk about how to treat Peyronie's disease and priapism. For Peyronie's disease, doctors can inject medication to the plaque in the penis to soften the hardened tissue, but patients can also model their penises, modeling being the forcible bending of the penis in the opposite direction of the bend. For less invasive methods, there's medication to reduce scar tissue and to break down the buildup of collagen that causes penile curvature. As a last resort, medical professionals offer surgeries such as implants, plicating, or cutting out the plaque of the penis and grafting skin over it, and experimental procedures like shockwave therapy, penile traction therapy, and radiation therapy. Treatments for priapism include the draining of blood from the penis through injection and medication that will allow veins to open up so that blood may flow out faster and more freely. Also, as a last resort, vascular surgery to reroute blood flow is also offered. Now that you know the options, I'd like to encourage you to speak up about these dysfunctions. Maybe it's your own or someone you know's struggle, and perhaps opening up communication and sharing what you know now will result in one more person seeking help. Statistics show that most men with Peyronie's disease are between ages 45 and 60, and it's not only limited to scar tissue on the penis. Scar tissue on the palms of the hands, the soles of the feet, and the eardrums can also lead to the disease. As for priapism, men between the ages of 20 and 50 are most commonly afflicted, and their risk increases when they engage in risky sexual behaviors or use a lot of drugs and alcohol. Both dysfunctions can lead to erectile dysfunction or penile gangrene, so it's important to act quickly. But why don't some men act quickly? Physical and psychological shame are pretty married to these diseases. Some men feel emasculated by reporting pain and looking weird. Men may feel that their partner will judge, and that leads them to feel depressed, stressed, and anxious. Maybe you or someone you know has felt this too, and now can walk away with the knowledge that there is help and a way out. So please, address your sexual health issues. Thank you so much for listening and have a good day.